Hey, good morning. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dulles Simons Family Studio. And what is it? Another wet morning here in Kansas City. Yeah. Looking forward to a little sunshine this weekend. The good news is we have some sunny news for you today. But we're going to, first of all, just introduce our guest, because remember we used to talk about COVID toes, skin rashes, hair loss. I don't know anything about that. And undiagnosed skin cancers. We'll add all that to the list of things impacted by this pandemic. Our medical director of dermatology, Dr. Anand Rajpara, joins us to help sort it all out. We welcome you here.
Thank you.
We're going to have a fun discussion. I already told him he's going to answer why I keep losing hair. I don't think it has anything to do with my kids, but maybe it does. But first, Hawkeye, how are we doing overnight?
We're doing pretty good.
We are doing pretty good.
You know, I think in the metro area. What's that?
We're back down.
We are back down. In the metro area, we had seen a rolling 7-day average increase, went down. Right now it's continuing to be just in that 120 and below for the rolling 7-day average of cases in the metro area. Here at our hospital, we have 7 active infections. 2 in the ICU, and unfortunately 2 of those are on the ventilator. So that's a problem, you know, very ill. But again, overall, the total number of active infections is down. We still have 13 in that recovery period, and Hays has 1 active and 1 recovery. We should also note that of those 7 active infections here at our hospital or our health system, 5 of those were symptomatic, and 2 of those are asymptomatic, found on screening, admission screening. So overall, active infections are down, and that's a good thing.
That is a good thing. And think about it, too, as you pointed out, that the active screening, when you take those out, it's even lower than 7. So that's actually a really good number. What does that mean? It means that vaccinations and infection control actually work. And even though if you're vaccinated, man, the rules got a whole lot better. Remember that the rules of infection control still protect you wherever you go.
And we saw, you know, just a new letter published in the New England Journal of Medicine looking at nursing homes.
Yeah, I was just going to say that was a great article, a great
More
letter.
than 10 times reduction of those patients getting disease and going to the hospital.
And by having so many people vaccinated, 85% of the residents were vaccinated. Even the ones who weren't vaccinated are then protected because all these other folks have been. So what it just tells us is, man, get your vaccine and we can take care of each other. It is so good.
Yep, and that's the microcosm of population immunity.
And that's 1/3 of the deaths in the United States have been out of nursing homes. And so that's the most vulnerable population. And the vaccines, without question, have demonstrated efficacy in that population.
Yeah, and more bright spots for vaccine handling, too, is coming out.
Yeah, talk about that. Pfizer.
So Pfizer, we know that these vaccines have really good efficacy even against these known variants. You know, again, much better than natural infection. There was always a concern because of the extreme cold temperatures needed to store and transport the vaccines, but now Pfizer has been able to get authorization or approval for refrigeration after thawing for a month, which is really good.
That's
so it's going to help those clinics and even maybe some of those mobile units, just, again, getting access to people.
And that's what we need to do. In fact, if you know people who want to get vaccinated or need a mobile clinic or a mobile van or whatever, come over and help vaccine, please let us know here at the health system, because we've got vaccine available and we want to help you get it. Next point to be made about that, and it's important, is that just how strong these Moderna and Pfizer vaccines are. It is unbelievable. And actually, an article out of South Africa today, also published in the New England Journal, suggests that one of the other new vaccines is not as effective against the South African variant, even though we know that Pfizer and Moderna are very effective. So just showing the strength of the mRNA vaccines. And, folks, the efficacy of the mRNA vaccine. So efficacy and safety, strength, this is the thing you need to do.
But they are all still very effective against that severe disease and death.
Yes,
so
exactly. Even in that acquisition, it's still good against disease.
And that way, you know, if you say, well, I don't want 2 doses, I don't want to come back in a month or whatever that time frame is, 21 days or 20 days, I just want a single dose vaccine. That is still very efficacious against protecting you against hospitalization, severe disease, and death.
Including the Indian variants, which are a major concern right now. So really, the best vaccine is the one you'll agree to put in your arm. The worst vaccine is the one you waste. Don't do waste. Bad plan. All right. Let's see if there's any reporter questions out there. I'm not hearing any. That just gives me a chance to sing. And what I wanted to say is, when it comes to all the skin rash stuff, don't just let it be, let it be. You don't want to let be that rash, right? Because those rashes are bad news.
Hey, Doc. you checking my rash?
Yeah, what's going on out there?
Yeah, we're definitely seeing a lot of COVID long hauler dermatologic symptoms now in our clinic. The most common one is COVID toes. 5 to 10% of patients with COVID toes will actually have symptoms that persist longer than 2 months. And another unique COVID rash, it's a psoriasis-like rash, has also been known to persist longer than 2 months as well.
So talk to us about that. What is a COVID toe, and what are the symptoms that you have?
Yep, so a COVID toe, medical name is pernio. Basically,
Say that again. It's what?
is pernio.
Sounds like pornography, but
Yeah.
it's not. It's just pornography.
Not that sexy.
Okay, there you go.
So the pernio, basically you'll get little vasospasms or tiny blood clots in the blood vessels of the toes. It can also occur in the fingers, and you get very painful purple spots on the toes.
Now, did you see that before COVID? Is this something new?
Exactly. So we've been seeing pernio for a long time. There's a lot of different causes. The main one's idiopathic. We don't know. But we always look for underlying connective tissue disease like lupus and also abnormal proteins in the blood like cryoglobulin. What was very interesting was that we never before saw this large amount of cases in the spring, because typically it only occurred in the winter when blood flow to the fingers and toes was reduced. So when we started seeing it in the spring, we were questioning what's going on, what's causing this, and now it's known that it's definitely COVID is one of the instigating factors of why we're seeing so many cases in the warm weather.
Is there a long-term injury from that?
So there is no long-term problems, mainly just discomfort, problems walking, problems with pain. In the COVID long haulers, where the symptoms last more than 2 months, a lot of times we'll have to put them on calcium channel blockers like nifedipine to help improve blood flow to the fingers and toes, and that can alleviate the symptoms.
If you can tolerate it. Because some people who don't have a really high blood pressure to begin with, especially those who are younger, may not do really well on nifedipine. That can be a problem too. So when people present with that, is it pretty disabling, or how bad can it be?
So it can be pretty bad. We've had patients come in that aren't able to walk because of the pain. And so that is the main reason they usually seek care, or they'll do a telehealth visit for it. In a lot of cases, just some mild itching and burning, but in those patients that it's severe, obviously we need to treat.
Yeah. So how do you handle, or what do you, I said to folks who are reporting hair loss during the pandemic. Of course, I wouldn't know anything about that. But is this from getting COVID, or is it related to stress, or all of the above? What's going on?
Exactly. So we are seeing a large rise in hair loss right now. It can actually be both due to COVID illness itself and the severe emotional stress of dealing with pandemic-related issues such as loss of a loved one. When we have severe emotional stress or physical illness, our system is shocked. So the body actually goes into conservation mode to save energy and stops non-essential functions, and one of those is hair growth.
Oh, wait, time out. You mean this is not considered essential up top?
Not as essential as running the lungs or heart.
Okay, fine. I do believe that.
Yeah.
Yeah. So what happens then? Will it come back when the stress eases?
Exactly. So what we tell patients is, that it's completely reversible. You will not go completely bald. It takes about 6 to 12 months for the hair to fully regrow. But again, in our COVID long haulers, where the stress is continuous, then you can enter a chronic state of hair loss.
So what's the youngest COVID long haul patient you've seen?
What is?
How old? What would be the youngest age as far as?
I recently saw a 25-year-old with long-lasting COVID toes, which we did have to do nifedipine.
Wow, that's tough. So just again, point out, remember on that long haul syndrome that we talk about a lot, it doesn't really respect age. We could say, oh, well, COVID, more older people are the ones who, like myself, get kind of sick or die. Well, A, that's not even really completely true. But B, long haul syndrome isn't that way. And it doesn't matter if you were sick up front. You can get really sick with long haul later.
Yeah, absolutely. And multiple things. Dermatology is a great specialty to have in our multidisciplinary clinic. And we know that, in our clinic, up to 30% of people are seeing 2 or more specialists. So it's not just COVID toes, and it's not just brain fog, but it's a combination of these things as well.
And what we know is there's a good answer to how to prevent that, Hawk.
Yeah, easy. Vaccine.
Live long and prosper. Get vaccinated, people. That's our plan. All right. So we've talked about hair loss, we've talked about COVID toes. Any other kind of funny rashes that patients with COVID-19 might have, or with long haul syndrome?
So we now know there's 5 different types of rash you can get with COVID itself, which is, very different than most viruses we've seen. You can get a chicken pox, vesicular rash. You can get a.
So tell us what vesicular means.
Okay, yeah. So you can get little fluid-filled bubbles all over your skin.
Okay, that looks really good.
Yeah, it's not a good look.
No.
And so we
Kind of looks like a herpes outbreak.
exactly. Yeah, herpes, shingles, and so it can occur. There's 5 different ones, and they're well categorized now. And
What are the other 4?
the other 4, you can get it's what we call a viral exanthem. So it's kind of pink, scaly bumps all over the body. The most severe one we usually see in hospitalized patients that you would see in the ICU is a livido reticularis type rash. It's kind of a lacy rash on the body where the blood vessels are actually getting clotted or clogged. It's related to the virus's ability to cause a hypercoagulable state. So these patients also have DVTs and PEs and stuff.
Lots of blood clotting. So that's a result. The livido is a result of a lot of blood clotting going on throughout the body.
Exactly.
That is not a rash you want to have.
No.
Exactly. And then we touched on the COVID toes as probably the most popular. And so a variety of different things. And then the long hauler symptoms, the hair loss. And the same thing that happens with the hair actually occurs in the nail as well. So the nail actually stops growing during times of stress, and it'll result in horizontal depressions throughout all the nails called Bowes lines. So patients come in a lot for that too.
So really, this sounds like something you don't want to have. And again, we know the answer: how to prevent long haul syndrome and how to prevent all these funny things from COVID-19.
Vaccine.
Get a vaccine.
Get vaccinated.
Awesome.
And it
All
comes
right.
back to this hypercoagulable state in these blood clots, not just in your
Yes.
lungs, your legs, but showing skin effects and concerns over the vaccine because they cause those blood clots in those very rare instances, as opposed to 20% or more of people that get COVID-19.
All right. Well, Jill, let's see what questions we have from folks out there.
They have a lot.
I bet. Dermatologists are popular, so
Yeah, they
that's all I can say.
I'm getting paid by the hour.
Smartest
Yeah.
people in medical school,
Oh, don't
right?
give them that credit. Come on, stop that. I think it was the pulmonary and ID guys that were the smartest guys.
I'm not sure it was internal medicine.
Oh, maybe
and
not.
ID.
Yes, it is.
I was only number 2 in my class.
Right.
Oh, Lord, here we go.
I love
Man,
that.
I'm going to get air
Okay.
sickness here. All right.
All right, so Lori must know you because she says, "Hi, Dr. Raj."
Hi, Lori. How are you?
Yeah. She said, however, I don't know if you're going to like this, I stopped taking Otezla, am I saying that right?
Yes, correct.
For psoriasis during the pandemic because it changes the immune system. If I'm vaccinated, is it okay to resume? Should she have stopped?
That is actually an awesome question because we've been studying that and actually doing studies on that here at KU. So Otezla actually is non-immunosuppressant category. So it is safe to resume for sure. At the beginning of the pandemic, we did not know, obviously, if these immunosuppressive drugs, Otezla is a pill by mouth, but we also use a lot of injectable shots for psoriasis like Humira and Enbrel. We didn't know if they'd be safe or if patients should continue them or discontinue them, if it put them at increased risk of getting infection, would they get more severe infection. Now, we actually have great data that shows that patients with psoriasis on these biologics did not get COVID more and did not get more severe COVID. So the data now shows, in hindsight, we know that it was okay to continue, but at the time, it really was a personal decision whether to continue or to stop without the data.
Cindy wants to know, are you seeing a rash as a short-term side effect from the vaccine?
Great question as well. So there are a lot of rashes that we're seeing with the vaccine as well. Luckily, it occurs in about 1% or less of patients, and it's typically with the Moderna vaccine. The good news is we've also studied this, and any rash that occurs 4 hours after the vaccine, we know are mild, they're limited, they're not harmful. And the main thing is that it usually does not occur with the second dose. And even if it does occur with the second dose, it's milder. So we really tell patients that even if you had a rash, or there's something called COVID arm now, where 7 days after the vaccine, you'll get a really big, red, painful, swollen arm. But it's not a reason not to get the second shot. You still should get it. It's safe.
And so, any idea why it's more true? Except Pfizer and Moderna are so similar. Why would it be true with Moderna and not Pfizer?
So, exactly. It doesn't have to do with the vaccine itself, we think. It's more with the preservatives in the vaccine. So Moderna has some polyethylene glycol isomer that we're not sure, but we think that's what's causing these delayed type hypersensitivities.
Okay. I thought that was in Pfizer too, but I guess maybe not.
Yeah, I mean, they both have really just a small number of components, like
Yeah.
you said, like 9 or 10 each.
Might be just a
Interesting.
little difference in the molecule.
But I think these first two questions were really good because we know the first patient that was asking that question taking this drug, and there are so many drugs that are improving people's quality of life, but yet they come with them, and you hear this on their commercials, a litany of adverse side effects in these drugs that people will take on a daily basis or a weekly basis or a monthly basis. Yet we know that people are still concerned and fearful of taking a vaccine one time for something like getting sore and ache in the shoulder site or getting a fever for 24 hours or aches. And we know the overall good that these vaccines can do, which people are still hesitant about, but yet there are still a lot of people who want to take these other drugs on a daily or weekly, monthly basis, and we know the litany of problems, but yet they continue to improve their quality of life. We know that that's what this vaccine can do as well. Overall, it's going to improve your quality of life and hopefully extend your life because you're not going to get infected with, or you won't have severe disease from COVID-19, and hopefully, avoid that mortality and that death.
Yeah, I think that's a great point about how important it is to recognize all these side effects from all the other medicines you're on, or for that matter, alcohol, tobacco, and caffeine, which have a whole lot more side effects than does the vaccine.
Well, let's not talk about caffeine in that way, please.
But did you notice how I just rhymed that pretty well?
Yeah, I did.
Tobacco, alcohol, caffeine,
Yeah.
a lot more side effects than vaccine.
Vaccine.
That's not bad.
You're a poet.
I don't know. Maybe I didn't know
You
it.
are multi-talented. Dr.
really.
Stites is multi-talented.
Next question.
Okay, this one's from Sherry. And Sherry, what is your grandson's name? Because I want to show his picture at the end of the broadcast. So if you want to share his first name, we'd love to have that. She wants to know, have you seen any skin side effects with the vaccine? Specifically, her brother-in-law got psoriasis when he got his second shot. Is that related?
So we are seeing some reports, and I've had some patients where their autoimmune diseases such as psoriasis or pemphigoid have flared a little bit with the vaccine. Luckily, it's pretty temporary. On the other spectrum, we've had some people whose autoimmune diseases got better. So, the vaccine definitely revs up the immune system and activates your T cells, and this has a complicated pathway to causing psoriasis. So it can go either way, but in the patients I've seen who have gotten worsening psoriasis or other diseases, it's very temporary.
Okay, Pam doesn't say her situation, but I think she's asking about COVID toes. She says, what about discolored toenails? Looks like I smashed my nail. I have had 2 since November.
Okay. So, hard to say without looking at a photo, but I'm guessing it's more subungual hemorrhage, which means bleeding under the nail. And that probably is more related to trauma or, if she plays tennis or the toe repeatedly hitting the shoe or something like that.
Okay. Selfish wants to know, and I can't say this,
Did you say shellfish once?
cell, like C-E-L.
Got it. I was just trying to be funny this
I
morning. because I'm
know.
a
It
little
would be
wacky.
funny. That would be funnier.
It would be good.
Selfish should maybe consider changing to shellfish.
Yeah, maybe so. I don't know.
Anyway, he wants to know, or she, could COVID cause, and it says PITY RIASIS rosacea.
Yeah.
Yep, pityriasis rosea.
Thank you for saying that.
Exactly. Yep, that is one of the categories of rash that can cause it's in the papulosquamous category. So you can get psoriasis-like rashes or pityriasis rosea type rashes, which will kind of look like a Christmas tree pattern of little spots on the back.
Yeah, just to be clear, there are 2 fields of medicine which are really foreign languages. One is dermatology and the other is ophthalmology. And if you just remember that, you'll understand that half the time you don't know what they're talking about, which is why dermatologists feel smart, I think. I don't know. They have their own language.
Isaac wants to know, oh my gosh, these are coming in so fast. Why don't people bleed from the needle puncture when they receive the vaccine? Does the wound close up right away?
That is a good question.
Well, first, it's an incredibly small needle.
Yeah, I mean, I think it's just the mechanics of the
Yeah,
small
and
needle.
indeed, your skin does rapidly close over
Yep.
something like that, but it's just such a small needle, and that's really why you don't believe. And you may have a little bit, like I have a tiny amount of blood, but it's, you really don't. It's almost more like getting yourself up the old pinprick when you had to do your own glucose test strips before.
Yeah, I mean, I think that's why the skin is such a great organ, right? I mean, you would,
The best.
The best.
it is a great
I
barrier.
talked earlier to how the heart and lungs are more important. Really?
The largest.
It is a great
Okay, fine,
barrier
it's
to infection and problems and issues, and I think, just as you said, it closes up pretty quick. It's a very small needle. Also, you aren't hitting a major vessel or anything like that that would induce a lot of bleeding. So.
But it does feel really nice when the nurse puts a little cotton ball there, and
Does that
Yeah.
make you feel better when they do
it
that?
does.
Okay, there you
If
go.
she,
We'll
if she
make
would
sure
kiss
about
it, it would
that.
be even better. But
Can we put another marker up here for cotton balls? It'll go up there with Star Trek, I assume. And now we're going to see if we get Jill to say cotton balls every morning.
Carla says, I had a friend just last night tell me that she wasn't going to get her second dose of vaccine because she has had hair loss and nail issues. And she said, is this something that could have happened as a result of the vaccine?
So we have a pretty large study of all the cutaneous reactions with the vaccine, and hair loss and nail findings are not a part of it. My guess is that it is more related to the stress of the pandemic, like we talked about. That can definitely cause hair shedding and nail changes. So I think getting the vaccine and being able to feel secure would be the best solution to helping the hair and nails.
And just to say that you saw hair loss and these changes in patients before COVID-19 ever happened. And so it's really, I think your point about stress is so important. We know I deal with the patient population of the cystic fibrosis, and so especially before the new drugs like Trikafta, they were always stressed because they're always sick. Yeah. And man, did they always have nail changes and hair loss. Because life is hard sometimes, and when you're really stressed by it, those things really come out. So I'm with you. I would say COVID-19 is a way, the vaccination is a way to help prevent that, because you can feel better about going back out in society again.
Becky wants to know, can you get swimmer's ear from COVID?
No, I've not heard of swimmer's ear. Have you?
I have not.
I'm not aware of that.
No, that would just so you know, that's like an infection in the external ear canal, and I don't know that I've heard of that one with COVID-19. And I had a really good friend who had some hearing loss after the vaccination, and I don't think that was related. I think folks can get random hearing loss anyway, or you can get viral inflammation in your ear that can cause hearing loss without having it anywhere else. And the virus doesn't just have to land in your nose, your throat, or your gut. It can land in your heart.
Yeah.
It can land in your lungs. It can land in your ear. And that's just routine.
Yeah, and I don't see a mechanism for getting swimmer's ear, which, just as you said, is an external ear canal infection or inflammation with COVID-19. Or I don't see that mechanism really for the vaccine either. So it's probably an unrelated issue.
Okay, so I think the crowd is trying to point out how bad I cannot say medical terms, but Jean wants to know. We may have to spell
it's a foreign language.
I know,
telling you.
we may have to
Foreign
spell
language
again.
right here.
Can you get tinea, Tinea? Bursa Did I get it right?
Yeah, that's exactly
Wow,
right.
that says
I'm
just like it
impressed.
looks.
All right,
From
well
the
done.
vaccine or COVID, is that the same thing? Is tinea the ear? What?
Yeah.
No.
So, tinea versicolor is just a very superficial fungal infection on the skin. Very common. You just get salmon, pink-colored, little round patches on the kind of chest and back. And this is spring, summer is typically when it comes out. It's very common, but has nothing to do with COVID or the vaccine.
Big athlete's foot, things like that. Too.
Yeah.
Yeah.
Then you get tinea pedis and et cetera. And did I say that right?
Exactly.
Not bad though. Yeah. Okay. See,
You guys are
that's
killing it.
cool.
Dr. Stites, Becky said, it's not really swimmer's ear. It's a full feeling in the air, and it only happened after I got COVID.
Yeah, I don't. I'm still trying to. I'm not sure about
I
that.
think we would, need to see your primary care doctor. Again, I don't necessarily see a mechanism for that. Certainly have not heard about that.
They said after she had COVID. Yeah, COVID is so funny. I mean, I'm not going to say that can't happen,
Right.
because COVID can cause just about anything. And remember that the vaccines are not COVID, right? It's just a spike protein, so you're not really going to get the full-fledged funnies and all the stuff that you have with COVID. That's what makes the vaccine so safe. But I've not heard of that particular thing, but I won't say that it didn't happen.
Yeah, I mean, I think it's worth, again, seeing somebody to get the full story, get the entire narrative, get the exam, the evaluation, and then really kind of
Make sure
discuss
there's
that.
nothing else that's related
Yeah.
to it. Yep.
Okay, Barbara's listening to what you said about the heart and that kind of thing. She goes, after my second Moderna shot, I had tests for heart issues. My D-dimer was high, as if I had a blood clot, and I was sent for other tests. Is that happening?
Again, I don't think, people are trying to say, gosh, it's the vaccine.
Yeah.
And it's funny
Yeah.
how we want to blame the vaccine on a lot of things. And what you have to remember is that diseases happen all the time, every day.
Mm-hmm.
The question is, did you get a vaccine, and the disease you then got, was that going to happen anyway or not? And people want to blame it on the vaccine because the vaccines are, quote, rushed, or they're new, or they're different. Okay, A, Pfizer Moderna vaccine technology is not new. It's been around for over a decade. B, people did not get the polio vaccine because that was new. And believe me, the polio vaccine has a lot more side effects than the messenger RNA vaccines, or for that matter, J&J. C, we know that people get diseases and and you think, well, I'm perfectly healthy, but there's something brewing in the background there. And then you may have heart disease. You may get lung disease. People have pulmonary fibrosis, and we don't ever understand why that happens in most of the time. Vaccines didn't cause that. People have been getting it for years. So I think we have to be really careful with thinking that just because we got a disease sometime after we have had a vaccination of any sort, maybe you could have blamed influenza vaccine. You could have blamed the MMR. But vaccines, we've looked at this so hard. And the way you look at it is you take all the people who have been vaccinated, you take all the rate of diseases those people acquire, and you have to ask yourself, is the rate of disease in people after vaccination of any sort, and the CDC tracks this kind of stuff, and they say, do people who have been vaccinated have a higher rate of a disease occurring than those who were not vaccinated? And the answer is no, because the problem is diseases still occur. And just because you get the vaccine doesn't mean, and remember, we've given it to over 1 billion people in the world, and we've given over 90,000 or almost 90,000 vaccines here in the health system. So we look at that data very carefully to make sure, is there anything we're observing? Hawkeye, we're not seeing it.
No, and remember, those receptors on our body that the virus attaches to infect our own cells, they are found throughout the body. But they are in higher proportions in certain organs, such as the lung, the heart, the GI, the gut. So you have that virus actively infecting those areas where there are receptors. Now, people can get virus in their blood from COVID-19, but it's very transient, and it's not a very common or long-lived occurrence. So that's why it can get to other places in the body as well. But if you remember the vaccine itself, you're really just injecting the RNA for that spike protein in the shoulder. So some may get taken up there in the shoulder muscles and then presented, but it's just the spike. There's nothing out actively infecting anything or traveling through the blood system to actively infect or attach to those other receptors within the body. So.
I'm going to scroll back up to the top because we had a couple of questions that were not related to the skin, and then we'll jump back into the derm questions, okay, because they still are coming in. Lindsay wants to know, can you please tell us if those in the hospital are vaccinated or not? It would be nice to know if the hospital infections have anything to do with vaccinated or not vaccinated.
Yeah, you bet.
Are we having breakthrough
And we do
infection?
cover that every time. So
Yep.
What do you see?
So right now, we have an asymptomatic person, a 44-year-old person who was fully vaccinated, but again, not here in the hospital for that reason. This was a screen on admission that we found the positive test.
They're coming in for a different thing, like a
Yep.
surgery or whatever, and we test everybody still, and then you may turn out to be positive. And that's what we know is that the vaccines, they do help protect you from any disease acquisition with COVID-19.
Yep.
But even if you do get it, you're generally asymptomatic.
Yeah, 4 more of those 7 active patients have no vaccine documented, but 3 of those are actually having symptoms. So one of those is asymptomatic as well of the unvaccinated. There is 1 patient in the hospital with only 1 dose of the vaccine, and then there's also 1 that is fully vaccinated. But also, it seems like they had COVID-19 back in December of 2020 as well, and now has maybe possibly reinfection. So
That's
don't know the
unlimited.
full details of that, but
Yeah.
there is only one that is fully vaccinated.
But you think about that, if they had COVID-19, then they got vaccinated, now they're back with COVID-19,
Mm-hmm.
that's someone whose immune system is not right.
Yeah.
Because they've had COVID-19 twice, and even without vaccination, that shouldn't have
Yeah.
happened. So,
Brandy says, what about taste and smell? I don't have mine back from having COVID-19 in October. Am I going to get it back?
oh man, that's a great question. Hawk, what do you think? And I know that can go on for 6 to 12 months
Yeah.
afterwards.
Yeah, I mean, I think our best information is that it's the support cells around those nerves specifically that have been infected and may have some damage, especially kind of in the nasopharynx there for your smell. And I think we've had our ENT colleagues on. They've talked about smell retraining, but also that it will take time. I think people fully expect it to occur, to come back. It's just maybe in some people it takes longer than others. So.
Alyssa wants to know, you've talked a lot about immune-compromised people and whether the vaccine takes. She wants to know, what about people who have an anaphylactic reaction? Do they get the benefits of the vaccine?
I think the answer to that is yes. I mean, you have to separate the anaphylactic reaction, which occur in very rare cases, especially with the messenger RNA vaccines. You have to separate anaphylaxis from an immune response that's going to protect you against COVID. Those are two different parts of your immune system. It does say your immune system's working, so that's good, I guess, but you don't really want to have an anaphylactic reaction. So if we know you're going to have that history, we would probably generally try and shut down that part of your immune system when you get vaccinated, Hawkeye.
Yeah. I mean, I think have to just identify, was it truly anaphylaxis? Was it truly to the vaccine? But I agree with all that.
Okay, Carrie says, I have a friend who suffers from alopecia.
Oh,
Yay.
well done. She's going to get a degree here by the end of this.
I'm studying these words, okay.
Yep.
And has already lost 100% of his hair years ago. He doesn't take meds for it, but he refuses to get the vaccine because he's worried about other autoimmune disease popping up. How can I convince him to get the vaccine?
So from what she's describing, it's probably alopecia areata, which is an autoimmune disease where you can lose, your body attacks the hair and it can fall out an entire scalp or body. Again, we have great data on cutaneous reactions we have a registry where we document all the cutaneous side effects of the vaccine, and, evidence shows that there really isn't any autoimmune diseases that have been triggered, that are evidence-based, or we know there are a causal relationship there. So, I mean, I would just direct them to a physician, and we can discuss kind of the evidence-based reasoning of why we think it's safe and how the studies show that there is no causal link. There's a lot, if you go to chat boards and message boards, people have anecdotal evidence, but it doesn't pan out when you actually study it.
Okay.
All right.
Dr. Hawkinson, Becca wants to know, I have my husband and I are both vaccinated. Our kids are 6 and 4. Is it safe for us to enter a half marathon and return to fitness classes at the gym?
Again, the half marathon, I'm going to
Very
say
safe.
yes. You're going to be outside. You're probably not going to stay in that large crowd after the run
moving around
starts.
a lot.
Yeah, absolutely. So I would say the half marathon, yes, is going to be safe. We've always advocated for doing things outdoors.
Outside.
The gym classes, again, this is going to go down to your individual benefit and risk evaluation. Because we know that, settings like that have been super spreader events or large exposure events as well. So I think it just kind of boils down to your comfort with being able to do that, understanding that risk. People are trying to separate within those classes to be certain feet apart. With the reduction in the guidance and the restrictions, who knows if that's continuing to happen. So you just have to, on an individual basis, continue to evaluate that.
Yeah, I think that's totally right. And, the truth is that you think about who else could I bring it home to? You're fully vaccinated. We do know, although it's a markedly decreased number, that you can still spread the disease, but I believe it's a 90 or 95% risk reduction.
Yeah.
But you can still, so just think about who you're going to be around if you go home and whether they're vaccinated or not. Young kids, 4 and 6-year-old, generally do pretty well, but not always, and they can even develop long haul syndrome. Or they can develop the post-inflammatory syndrome. So, I mean, it is a good question. I think here's how I'm doing the gym. I'm not going back inside yet. I'm going to take a little bit of a wait and see approach because as the masks come off and things open up, that's great. For those of us who are vaccinated, I'm happy to go back to the K because I'm going to be outside. But, I think for things that are inside, I'm going to just be a little more careful. And one of the things I'd be most careful about is the gym, just because people are working hard, so they're going to be, they're going to be breathing harder and just going to expel more stuff. And I think it's kind of like choir practice. Not that anybody's invited me to join a choir, nor will they, but I wouldn't be back there right away indoors because of that same thing.
Shelby says, my dad is having tingling in his arms, muscles, and ringing in his ears after his Pfizer vaccine. Is this common? We are having him contact his doctor.
Yeah, I definitely think contact your primary care physician. I have tingling in my ears and ringing in my ears all the time, and I had it before I had the vaccine. I've had it after the vaccine. I think I'm going to have it for the rest of my life. Yeah. But I'm just, again, this is not something we're hearing on a regular basis. And we'll be really honest. I mean, we obviously want everybody vaccinated, but we also have promised you all along we're not going to be flapjackers. We're not going to flap our arms and jack with the truth, and we're not going to do that here either. So as things come out, we'll be the first to talk about, just as we were when the J&J had their concerns, we went right in and talked about the questions of cerebral vascular disease. And so I will be honest, we don't have anything to hide. We have built our reputation on our medical integrity here, and we'll continue to do that. But I don't know of that. I've not heard of that as a side effect of the vaccine.
I would just say try to get evaluated and monitor it. Yeah.
But I think there is, when we hear the questions, there is a lot of hesitancy and a lot of fear and a lot of concerns. And at least I think 3 of us are all vaccinated. I can tell you I was sick for about 24 hours, and after that I was fine after the second dose. And I'm just, when the booster comes out, I want to get the darn booster because I think it's going to be about a year. I'm going to bet sometime next winter I'm going to have a booster shot. Let's go. Line it up. Let's go. Because ultimately, COVID-19 is far, far worse than vaccine, folks. I think that's the bottom line. And unless you're going to stay masked and indoors all your life, meaning away from others, then I think you're going to have to think about, gosh, what am I going to do to try and help master that? And just remember the data we talked about early this morning. Looking at nursing homes, that is really the most vulnerable group as far as risk of death. And the risk reduction of vaccination in nursing homes is just remarkable. There's no way anyone could have thought that vaccination was going to work this well. Yeah. The Moderna and Pfizer vaccines and the J&J, they are incredibly, incredibly safe. Yeah. And I think that there's this general hesitancy out there, but I'm telling you, we're just not seeing it, and we're not going to jack with it.
Yeah, and we get questions of, well, what are you seeing in the hospital? Who are you seeing? I think the question needs to be, who aren't and what aren't you seeing? And number one, what aren't we seeing in the hospital? A large increase in our hospitalized patients for symptomatic disease, and especially those in that 80 to 85, 70 and older, those nursing home residents, those are what we are not seeing in the hospital. And I think that should be more of the tail of the tape right there.
Yeah, I think that's exactly right. And I'm glad you stopped at 70 and didn't go down to 60 this time. You've gone down to 60 a few times. You talked about old folks. All right, one more.
Oh, no. Just two. Oh, man. Okay, let me just say this. Dr. Rajpara, will you come back on because the questions are just lots and lots.
I'd love to.
Okay.
You're welcome.
They'll have me.
Yeah, we'll have you. We'll mess
Sorry,
with you, but you'll have you.
Shailene. I was going to
That's
ask
good.
your
I
question,
deserve it.
but I'm going to ask Lori's instead. I have Lori and Laurie. Lori wants to know, what age should people start seeing a dermatologist for preventative exams?
So that's a good question. We get that a lot. It depends on risk factors. So if there's a first-degree family history of melanoma, even any history of blistering sunburns, you have, more than 50 moles, you should get a baseline check. We think with those risk factors, starting at age, 8, 9, 10, it's good to get a baseline, and then we can schedule follow-up from there.
Yeah, for me, I go every 6 months because I'm a white guy who got sunburned a lot. And wait a minute, I may have seen you a few times.
And you used to have red hair.
I did used to have kind of reddish brown, but reddish hair. It was, yeah.
That'll do it.
I may not have been ginger, but I was
ginger.
Yeah, I wasn't quite like the Hawkeye, but there you go.
Laurie wants to know if people with run-of-the-mill skin issues like psoriasis, are they at more risk of catching COVID?
Yeah, actually, there was a recent study that showed patients with psoriasis, for some reason, were increased risk of catching COVID. Not necessarily due to the medicines or anything like that, the immunosuppressants they're on, but psoriasis itself somehow predisposed to COVID infection.
Can I just one more?
You better hurry.
Okay, last one. Okay, Mallory wants to know, can you speak to how helpful it is for vaccinated people to be masking and non-vaccinated people to not be? I'm concerned about the lifting of the mask mandate.
Oh, that was not a short question. Oh my gosh.
Well, okay, we can tune in tomorrow. I can put it on tomorrow's
We'll
list.
do it.
but-
We'll do it now. We'll do it then. Hawkeye. The mixing of patients. Here's what we know. And the nursing home data is interesting because what it said is that by getting 85% people vaccinated, even those who refused vaccination were also got a significant measure of safety.
Yeah.
What it just says is you don't spread the disease as much when a lot of people are vaccinated. I think the question, we have seen a huge drop here in the health system. There is just no way about that. And that is just great news, right? Because I don't know what the rates are out in the community, but the reality is the rates out in the community don't tell us as much anymore because of the lack of testing and things. But the hospitalization numbers are the bellwether. And what we know is we're not seeing anywhere near, I mean, we were at 125 acutes and 125 recovering. That's like 250 patients, and that was like 2/3 or 1/3 of our beds. So now what we're saying is that we're down to a really small number. Why is that? And I think it's two things. Three things. I think people really were doing better with infection control. And we know that in the city, that when we really began pushing that last fall, man, you could see it happen. You could see people change overnight. You saw the behavior changes. So that was part of the reason. The second thing is people got vaccinated. That's been great. And the third thing is, and unfortunately, a lot of people had COVID. And so you've created a pool of people who have had or have either had the disease and had the vaccine, or who also been masking. I think those are the things that have driven the numbers down. So if the numbers are down, then I think it is safer out there. The best way to do it is to be like a nursing home. If we get everybody vaccinated, we get 80% vaccination, man, society is going to be open and free and safe. That's what the nursing home data is starting to speak to us about. But in the meantime, there will be a risk to those who are unmasked and have not been vaccinated, and who those people go back to. That is a personal decision. I understand that. But at the end of the day, you're making that decision for yourself, and you're making it for all the people you're around. And what you have to remember, and you can have all the vaccine doubting in the world, it's just wrong. The reality is COVID-19 is so many times worse than having a vaccine.
Yeah, absolutely. And I think you have to assume when you go out into those places in public, whether it's indoors or outdoors, but especially those indoor venues and those events, that there are probably going to be people out there that are not vaccinated and unmasked. And individually, if you're vaccinated, yes, you are probably going to be really well off. Your spectrum of disease is going to be lower. But take example for myself individually. Going into that, I would be concerned about getting the infection and then even having like a cough or a sniffle or a sore throat for 2 or 3 days. Because then in my line of work, and a lot of people who work would have to go get tested. And if I get tested, then I have to be out of work for 10 days. So individually, it's important for me to continue to try and avoid infection, not because of the severity of illness or the concern for blood clots, because I am vaccinated and I feel fully secure in that, but it's more for having to miss work. It's a little bit different. So just understand those. And again, you have to take into your own account your individual risk and benefit, and what are the benefits of doing things, what are those risks if you do get infection, even if you are vaccinated. And for me, it'd be a major concern of, again, having to miss 10 days of work and be isolated for that time period.
All right. Hey, tomorrow, Amanda Cackler, the Director of Quality and Safety, is back with us. It is Friday. Hawkeye is actually going to be hosting tomorrow, and there will be a special guest who will be on the program. I am going to be out having breakfast with my daughter tomorrow. All right, team, final thoughts. Dr. Rajpara.
Get vaccinated. It's safe.
Yeah.
I like it. Good thing. And make sure you see a dermatologist, especially if you've been out in the sun a lot like I did when I was a kid. Got a lot of sunburns.
Yes. Get checked out.
Yeah, get vaccinated. Thank you for coming on the show. It's been a great show. Try to avoid COVID toes, so get your vaccination and keep yourself well.
Hey, we've got some cool photos here. In the week since the 12 to 15-year-old age group has been approved to get their vaccine, many have jumped at the chance. The next young man's photo warms my heart. Sherry's a faithful viewer who shared this picture of her grandson who received his vaccine last Thursday. Like me, very true, he is a big fan of Hamilton and refused to throw away his shot. I'm not throwing away my shot. Well done, Truman. I am not throwing away my shot. I am young, snappy, and hungry, and I'm not throwing away my shot. Apologies to Lin-Manuel Miranda. I just messed up with those words, but darn it, I love that turn of phrase. Hey, I want to see more photos of things like Sherry's grandson here, Truman. Well done. Please upload the video or photos. Go to Medical News Network at kumc.edu. You can get it there. Send us a photo and a video of your child getting the vaccine and a sentence of why they are not throwing away their shot. Don't throw away your shot. We'll see you tomorrow. Get vaccinated. Be safe. Keep us all safe. We'll see you then.